Hey, welcome to Brain Body Boost B3. I'm Dave Noriega with my co-host, Dave Dujanovic. We host a show on KSL News Radio, the Dave and Dujanovic Show, Monday through Thursday, 9 to 11. And today, Debbie, was the first time you and I saw each other for 6 months because of social distancing and COVID, which was very exciting. Now we're sequestered once again into our own little booths. And we're doing this a Zoom call. Everybody knows how this works. So
so excited about this, Dave, and the Select Health joining us now to talk more about it. Why don't we introduce everybody who's with us? You go.
Greg Reed, Public and Communications Manager.
I'm Emily Boyland. I am a Community Relations Coordinator at Select Health.
Hi, I'm Tim Best. I'm the Healthy Lifestyles Director for Davis School District.
So the Davis School District, that's my school district. Those are my people you're working with, Dr. Tim. So I'm excited to have this conversation. And Emily, let's dive into what B3 is, Brain Body Boost. Give us a little bit of an overview.
Yeah, I would love to. B3 Brain Body Boost is our program for the community to help students learn more about overall health and wellness while also getting them more active. So this is a school-based program housed in an online platform where teachers can log in and they can find ready-to-use lesson plans. They will find resources to help them teach health education in the classroom. And then all of this is done while motivating the students to be active.
Greg Reed with Select Health. It's so good to see you again here on this Facebook Live. So tell us, what are the age ranges of kids that can sign up, and where can teachers start getting their kids signed up?
Well, the age range for us is 4th, 5th, and 6th graders. That's an important age, and to us, it's a meaningful time where kids are reaching in the refrigerator without mom and dad and choosing something to eat. They're making their own decisions, becoming a little bit more independent, and we wanted to create something that complements lesson planning, wellness, and physical education. And B3kids.com, that's B, the numeral 3, kids.com is where everyone signs up.
Dr. Tim Best is with the Davis School District, the Healthy Lifestyles Director. And Dr. Tim, how can you keep my 10-year-old from reaching for ramen every single meal?
Hey, if I knew the answer to that. Of course, what we try and do is just give them activities. We do have a couple activities within this B3 program that can actually help kids make better choices, when they do head to the fridge.
Doctor, get into some of the details. Take us behind the scenes, and what are some of the lesson plans or fun activities that kids can do once their teachers sign up and they sign up?
Okay, well, since we're talking about food, here's one for you. It's called Go, Slow, or Whoa. It's the same as red light, green light, if you remember that great game back in the day. And so beforehand, we talked to kids about examples of healthy foods. What would that be? Fruit, low-fat milk, whole grain, eggs. Those are go foods because they make us strong, they make us healthy, and they don't really slow us down. And I let kids the teachers will let kids elicit responses on that. And then foods that have a fairly good amount of added fats or sugar, such as a pizza or a sports drink or a salad with lots of dressing on it. That could be kind of a whoa food. It's okay to have pizza, just don't have pizzas. And and then our
are you looking at me? Are you staring at me?
So that would be kind of maybe a yellow light, when they're doing that activity. And then a whoa food, I guess, or a red light would be something that like a candy bar or something that's doesn't have much nutritional value. And so after they've given responses, then we just light them up. And if it's a go food, you can, run, jump, hop, gallop, move as quickly as you want to. When you hear a slow food, that's kind of a yellow light. And, caution, we'll probably slow them down a little bit on that. And then once they hear a whoa food or a red light type food, then we don't want to give them a complex, but we want them to kind of make choices so they can figure out how fast they're going to run, and just like the red light, green light of years ago.
Greg, Select Health has been so invested in this and really taken years to set up the B3 program. Give me a little bit of an idea, the purpose behind it, why you thought it was important to invest in these 4th, 5th, and 6th graders.
Well, we've started this initiative 2 years ago and happy to be at this point where we're launching it. For Intermountain Healthcare and Select Health, we have the same mission, helping people live the healthiest lives possible. And within that mission, we try to move some healthcare initiatives in our communities: prediabetes, hypertension, depression, prescription opioid misuse, and let's throw in air quality too. We look to move as far upstream as we possibly can, and working with schools and school districts is about the best we can ever do. And if we can work on food choices, if we can work on air quality, I think generations ahead of us will be better off.
I want to put up the website again where teachers can sign up. This is a free program. Emily Boylan, I know you've been very, very involved in getting this launched. We're super excited to be a part of this and that you've invited us, Dave and I, to be a part of this launch. Walk us through what teachers will see, what kids will see once they get signed on to b3kids.com.
Yeah, I would love to. So again, really easy for teachers to sign up. Just visit that URL that you see on the screen there, the b3kids.com. And there is a sign up button there where the teacher will enter their school district, their school, then which grade they teach, and then also their name and their email address. And then they would click sign up, and then they would see their own teacher profile and their own teacher dashboard. So this gives them a quick idea of how they're doing in the program. They can see all of their students. They can see which of those health education strands that they're working on with their class. And then they can also check out some of the resources that we've gathered for them. So different things surrounding the various health topics like air quality, like disease prevention, some of those safety skills that they can incorporate into their classroom lessons they can find there.
What's a strand?
So a strand, that is...
And for example, let's show our producer Caitlin working behind the scenes here. Can we put that slide up of the library strand, and then maybe you can explain what a strand is, Emily?
For sure, yes. So the State Board of Education has designed these 6 health strands or 6 health topics to break up the health education material for our teachers. So these are the 6 categories or topics, if you will. And through B3, we have created a task list for each of these strands. So as a teacher participates in the program and completes some of these tasks, there'll be different things ranging from completing a lesson plan with students to watching a video, or, we completed a brain break. So different things like that are what are shown on the tasks. And then once they finish one strand, then they can move on to another one.
So as these teachers are kind of helping and leading the kids through some of these objectives, they can actually receive points, right?
Yes. Yeah. So as teachers can complete those tasks on those lists, once they complete one full checklist for one strand, they can earn 25 points for that strand. And then these points can be used to earn school supplies through our Amazon store that we have filled with school supplies. We have some PE equipment on there, and they have the opportunity to earn 25 points per strand. So if they did all 6, they could earn 150 points throughout the school year.
Dr. Best, you spent a little bit of time earlier during our Facebook Live talking about, how this encourages kids to make better food choices. Take us inside perhaps one of the exercises. I want to hear more about the exercises that this b3kids.com suggests our kids participate in.
Sure. So these are what we've kind of have done and accomplished, is to use activities that kids should do as part of a quality, comprehensive physical activity program anyway. And we've just kind of put it right into a nice, neat little package, and that's what B3 is. So these are things that kids, they're 8 locomotor movements, things like, walking, jumping, galloping, leaping, sliding, lateral movement, things of that nature. And it's just stuff that kids should do anyway, and things that they're going to be doing as a result of, their K-12 PE programs anyway. And we haven't really gone outside of the box anyway, but what we've done is just taken things that kids should do, at least on a weekly basis. Maybe not leaping per se. I'm not much of a leaper, but
socially distanced? It's socially distanced in this case?
They are, yes. We put some of that in there as well, like the COVID crush activity that we spoke of early this morning.
So I look at it, Dr. Best, and I think I've got a 5th grader, and if he learns anything in school, I will hear about it. Like 100%. If he's running and leaping and trying to eat healthy, I would imagine there's going to be kind of this trickle down effect to the rest of the family.
Yeah, sure. Well, we like to educate not just the whole child, but the whole family as well. And a lot of these activities, we encourage kids to not just grab, a classmate and peers, but also get your family involved. These are things that, they're fun. Get a couple of activities have like game boards and things where kids can use. We call them counting cubes. We can't call them dice anymore, but it's dice. But we use counting cubes. Roll the dice, and it's kind of like a bingo board, and it's just walk 3 laps around your house, and then jog 1 lap around your house. Things simple as that. Hop on your left leg 5 times, your right leg 5 times. Do push-ups during a commercial break during your favorite TV show. But also, primarily these are activities that they can do within the school setting.
Dave and I had the honor this morning on the Dave and Dujanovic show on KSL News Radio of helping Select Health launch a brand new website. It's free to teachers. It's free to students. E3kids.com is the website the teachers can sign up on, and the kids can sign up on, and teachers amass points, and they actually get free supplies through this amazing Amazon store, all to be used in the classroom. I love this. Emily Boylan with Select Health. Tell us about when kids sign up, how secure the website is, because I think parents are certainly concerned when too much information is online about their kids. Take us through that, and also what kids see when they sign up.
Yeah. So we have worked really closely with the State Board of Education to make sure that B3 is as safe and secure as possible. So we've worked closely with the student data privacy auditor who has reviewed the website. He's looked through our policies that we have in place and made sure this is a safe spot for students to participate in the program. It's a safe space for teachers as well. And we're really only collecting the bare minimum of information from our students to make sure everyone feels comfortable. And once a student actually signs up through their teacher and has their own profile, the student will be focused on logging their minutes of physical activity. So the teacher's more focused on the health education piece and completing those strands, while the student is focused on logging those minutes within their own profile. So they can see their weekly goal, which they set for themselves. They can see their progress on that. They can also see how they rank against other students in their class and other students in their school. So they can have a little bit of a friendly competition, hopefully. And they can also access different resources from there as well. So if they had...
Emily, let's put those graphics up on the screen right now. There we go. Can you walk us through that, Emily, what we're looking at right now?
Yeah, definitely. So you can see right in the middle there, that bar with all the different days. This is where the students are able to log those minutes there, and they can log those daily. They can do that in the classroom if that's what the teacher prefers. Maybe they assign it as a homework assignment. However they decide to do that is totally fine. And you can also see the weekly goal space. So the student will set this for themselves, whatever they feel they can achieve, what they can accomplish. And then they will see, as they enter more minutes, they'll see that progress bar move across the screen, which is fun. And then they can also see what they're doing in their class. So you can see Lauren is 8th place. And then she can also see how she's doing in the school. So she's in 8th place in school as well.
One of the things that this reminds me of, Emily, and I think maybe some teachers and parents are asking the question, like, are the kids going to get behind this? Are they going to get excited about it? And it made me think about a program, TTM, Think Through Math. And I cannot believe like how much my kids, like the entire school, got behind finishing lessons and doing these projects, and they were doing it collectively as a school, and they got so excited, and there were rewards, and as you were saying, they were competing against other schools, and I was blown away. I had kids coming home, my own kids coming home, sitting down in front of a computer and pounding out math project after math project because they were having so much fun with this. And it reminds me so much of it, where the kids can get like really behind it and start comparing how everyone's doing and having this friendly competition.
Yeah, we hope to develop some ownership within the students, some self-empowerment, that they can be excited and engaged in the program by seeing their progress move up, by, you know, adjusting their weekly goal and hitting new goals every week or every month. And then also with their minutes, then they are working towards a grand prize with their class. So at the end of the school year, we will tally all of the physical activity minutes that classes have reported, and the classes with the most number of minutes will actually be eligible for the grand prizes.
Dr. Best, as recess kind of gets cut down, or maybe it's very socially distanced, perhaps PE has been cut out of the curriculum at a particular school. How important do activities like b3kids.com offers to our kids to for their mental health?
Yeah, this is such a great opportunity for teachers because they have so much on their plates. There's just not enough time in the day to go as deep as they'd like to with a lot of the content areas. And so this is kind of it's, I hate to say it again, but it's a gift wrap package. It's a win-win-win. It helps with their supplies, but it helps with their students' mental well-being and their physical well-being, which, this doesn't work well unless our entire body's working well together. So, having these kids get a mental component and a physical component is great for kids, and it's great for teachers. It's really going to help them in multiple ways.
We got a comment from Cody Pritt that said, what inspired this program? Greg, you want to take that one? You might be on mute.
Yes, sorry. We looked at what we could do for the community, and rather than sponsor a series of road races and other things for the betterment of the health, we wanted to move upstream as possible, as far as possibly we could. And the health of the school is very, very important. Schools are central to every community, regardless of where you're at. So that's why we wanted to start with the schools. And we wanted to use the resources of Intermountain Healthcare, of Select Health, of Primary Children's Hospital to really make it meaningful. And Dr. Tim Best has helped us with the lesson plans. We wanted this to have not just a year shelf life, but we wanted to be able to evolve with the learning that's happening over the next 10 years. Emily and I did a very, very deep dive, and we can honestly say that this is a unique program. There's nothing like it in the country, and we're happy to be able to announce it and make it available to Utahns.
You know what makes me so excited about this in this pandemic, Emily, and I want you to maybe pick up on this when I offer my thought here, is that all you need to do is go to that website, b3kids.com, and sign up. We don't have to go line up somewhere to be a part of this program. My question is, can any school sign up? What about kids that are participating in online school right now, which is thousands of kids who are only online right now? They're not in-person learning. And also, what about homeschoolers?
Yeah, so it's really easy to sign up. Like you said, they can access everything through their online platform. And it's nice because this can be accessed from a home environment. It can be accessed from the classroom. The website is available in a tablet or a phone view. So if a student doesn't have access to a laptop or a desktop computer, that's not going to prevent them from participating. And also the lesson plans and the resources that we have collected can be, adapted to different situations. So whether that be, at home with 3 kids, you can utilize that. Or if you're in a classroom with 10 students, you can also utilize it that way. We have a really great variety of resources, and those lesson plans can be adapted based on what your environment is.
Dr. Best, we just got a news alert, and we've had this spike across the state in COVID cases, and today it looks like 911 new cases. So much has changed for kids, whether it's completely online learning, it's a hybrid schedule in your district, in the Davis School District. Can you just talk a little bit about the importance of getting kids out and active when they don't have the structure of school?
Yeah, that's a great point, and 911 test is a reason certainly to call 911 or 911, but we want our kids to have just another avenue, if things go, in the wrong direction, and we have to have more remote learning occur. And so this is something that they can access in and out of the classroom, in and out of the home at any time. They can pull up some of these activities, like Emily was talking about, log their minutes and things of that nature. So we can't stress enough how much, it's just important and vital that these kids have an avenue and an outlet to, use some of their free time, which they would have a lot if they're, outside of school, and use that in a appropriate manner. Because, one fact is, up until the beginning of the time, until 2012, the number one time consuming thing for humans was sleep. And in 2012, that was replaced with screen time. So our kids and, even adults, we're on screens more than we sleep every day. And so obviously if we're in a remote digital learning setting, then they're going to be on screens a lot. And so this activity, these activities allows them to, find a lesson, go outside, the living room, classroom, anywhere there's space, and start exercising, get that physical activity as part of their day.
I'm just looking at a tweet now from Lieutenant Governor Spencer Cox about this case count, over 900 cases for today. It says, quote, "Today is going to be another terrible day for case numbers across our state." That's Lieutenant Governor Spencer Cox tweeting that. But Greg, I am so happy. Dave is happy. KSL News Radio is happy. We are thrilled to be a part of this movement, which is so incredibly hopeful for our kids and our teachers. It's not only free, it gets the kids out and exercising. It makes them healthier. It gives them tips on how to eat better. It encourages them to exercise more. And it's free. And it also gets supplies back into the classroom for teachers for free. I mean, truly, this is a win-win right now when things can feel so negative.
Agreed. And we need everyone's help to spread the information about B3 and make it available to your school district. We have over 40 school districts, and we have over 525 elementary schools. And within those classes, there's usually multiple 4th, 5th, or 6th grade classes. So we want to be able to get this out and get this in use. I saw a comment come up on our screen, how long will the program last? We want the program to have a very, very long life. We want to be talking about this 5, 6, 10 years from now, and be talking about the success points that this represents, and that it is scalable to move outside of our state.
Dr. Best, you've had this idea that you don't want to put more on the teachers. The idea behind this is we're trying to make it turnkey. This is supposed to be a help to you.
Correct. Yeah. What we're trying to do is just, our teachers, like I've indicated, they have so many things on their plate. But part of that core curriculum is to teach physical education, and the health core. And so this is a 2 into 1, which is kind of even more beneficial, frees up more time because everything's done. Select Health has put it into one great package for them, and it teaches, it meets their health and PE core standards.
Emily, after we got through with the Dave Dujanovic show this morning, one of my really good friends, she is in the schools in Tooele County. She reached out to me and said, do they have an app yet? And I texted her back and said, I think they're working on one, but we're going to talk about that in a few moments. And let's talk about that now. Are you working toward an app?
Yes, absolutely. We want B3 to be as accessible as possible and know that an app will do that for us. But right now we are just available online. But again, it's available in that phone or tablet view as well if someone doesn't have access to a laptop or a computer.
You talked about simplicity and how important that was as you were designing this program, that teachers aren't going to be confused or have to spend a lot of time. Do you have an estimate of how long it would take a teacher to set up or update these things for their students?
Once they are set up in their profile and they have all of their students added into their class, it should really be super simple. They can enroll in whatever health education strand they want to work on with their class. Then they have all of those lesson plans right in front of them that they can review and find, okay, this one maybe would take 10 minutes, but I have 30 minutes today. So I'm going to look at some of these other ones that maybe would take a little bit longer. So honestly, the lesson plans, again, they are very adaptable. They can be shortened, they can be lengthened. You can have a further discussion with the students about whatever topic it is you're covering. But I would say anywhere from 10 to 30 minutes, these lesson plans can be adjusted to fit the teacher's schedule and what they're envisioning.
Let's go around the Facebook Live now and talk about any final thoughts that you may have or pitches that you may have. Dr. Tim Best, why don't we start with you as we kind of wrap things up here? Final parting words.
Check it out. I mean, it's I love the program, and I'm not I'm not a paid endorser, spokesperson, or anything like that. But this is it's going to be great for our kids, and now more than ever, they need just it kind of helps with normalcy. Kids always, it's an innate in our in our DNA just to move. That's what our bodies are built to move, and if we're inside and whatnot, and that sedentary lifestyle, this is a great program to get kids up and off of the couch, and if they're going into the fridge, like Greg said, this is they're going to have the ability to make a better informed decision as a result of this B3 program. Greg?
Yeah, well, we're all surrounded by opportunities, and I wanted this one to be a discussion point with you as a coach, with your listeners or viewers as a member of the PTA, or just a close advocate of what's happening in your schools. We'd like to let this kind of breathe a little bit and let everyone see the opportunity that this presents.
Emily.
Yeah, I'll close it up. B3, we've worked a lot on this program, and Greg and I are not teachers, so that was one reason we brought Tim onto the team, was to help give us that perspective of how a classroom teacher works, what would be helpful for them. And so we really want B3 to be seen as a tool and a resource in the classroom, not only in, the school supplies that teachers can earn, but also in the lesson plans that are provided, in those additional resources that they can access from their profile as well. All of these things we hope will further that health education in the classroom.
And before I turn it over to Dave to close out, I just want to say, as a mom who's raised 3 kids now in their 20s, I always felt that exercise was such an important way to bring our family together. We we always played softball together, or baseball together. I mean, occasionally there'd be a sibling rivalry or something that went down, or maybe I didn't get out of the way of the line drive in time, so mom got hit in the ankle. But we had a blast as a family. Anytime we'd take the kids out to play catch, my youngest daughter and I run together once in a while. I mean, she runs way faster than I do. But as also a mom who has dealt with significant amounts of anxiety over the years, I have found exercise to be my natural cure. And that is a lesson I've hoped to pass on to my own kids. And so I love this. I love b3kids.com because it puts the tools in the hands of our children. It gives them something to look forward to. I look forward to my, daily exercise routine now, because I know it just helps the brain work that much better, and it makes me feel better. So I applaud all three of you. I applaud our friends at Select Health. Thank you so much, Dr. Tim Best, for coming up with these amazing ideas for our kids. Thank you, because I want our kids to be healthier, and I think this is a great way to do it. It sounds like a fun way to do it. And why not, Dave? The kids get free school supplies back in their classrooms.
It's all offered because of Select Health. We thank you so much for joining us on this Facebook Live. Again, go to b3kids.com. It's going to walk you through absolutely everything. A cool new program, Brain Body Boost. Select Health, Dr. Best, Greg, Emily, thank you so much. And we look forward to seeing this unfold over hopefully many years.
Agreed. Thank you.
Thank you, guys.
Thank you.
See ya.
Thank